And then in specialty hospitals, kasi I'm sure our colleagues are like our office are always recipients of requests for assistance dito sa mga heart center, lung center. So we also put 1 billion in as part of our committee amendment in all of these specialty centers. And then we also have the progressive benefit expenditure, is that correct? Expenditure, where benefit expansion, where yung available o yung available sa tao na benefits is expanded, and then we are moving from the case rate to the DRG system, so that yung under the DRG there would be, it's a diagnosis related grouping. So isang particular na sakit, let's say sabihin mong flu, lahat ng klaseng flu pwede niyang himayin kasi under the case rate, dalawa lang yan, yung mild and severe. Pero under DRG, marami yan. So it's technical, but it's meant to address different health scenarios, Mr. President. So these are what DOH is doing, Mr. President.
Thank you for that answer, Mr. President, distinguished colleague. And again, let me commend and congratulate our distinguished sponsor for continuously espousing the augmentation of our budget and in realizing our dream, our ambitious dream of having this zero balance billing. I remember distinctly, Your Honor, distinguished colleague, during the SONA of the President, we were all looking at each other about this zero balance billing. I remember even the presiding officer, Senator Lacson, is also looking at this representation when we heard during the SONA about the zero balance billing, because everyone in our section are asking each other, is it possible? Is it being implemented now? Right now, Mr. President, where are we in so far as full implementation of zero balance billing is concerned, Mr. President?
So, Mr. President, the secretary who stepped out very briefly is telling me that they really are implementing the zero balance billing in the hospitals, DOH hospitals. So kahit na meron silang binabayaran hanggang 2 million na babayaran po ng DOH.
And these are DOH devolved hospitals, no? Hindi devolved hospitals, I mean. DOH...
DOH retained hospitals,
retained
Mr.
hospitals.
President.
Yeah, thank you, Mr. President. Mr. President, let me go to another
Senator
topic.
Villanueva?
Yes, Mr.
Just a quick intervention. There's 1 billion out of the 10 billion, di ba, for ZBB, for zero bill. There's 1 billion for LGUs out of the 10 billion. That's in the committee report. My question is, how many LGUs are expected to be covered nung 1 billion?
Sorry, what's the question, Mr. President?
There's 1 billion pesos for LGUs out of the 10 billion for zero billing, di ba?
Yes.
Ang tanong ko po, how many LGUs are expected to be covered by the 1 billion? Kasi baka kulang na kulang.
Kulang po. I'll be the first to tell
So how
His
many-
Honor na sobrang kulang talaga yon.
So how many LGUs are expected
So
to
they
be
will
covered?
just be piloting it with 4 to 5 LGUs, Mr. President.
4 to 5?
Yes, only. That's very small.
Oh, there's no-
His Honor well, I don't know if His Honor would know, but the idea really here was, instead of giving additional MAIFIP, we bring it directly to the hospitals.
Yeah.
So that's why we spread it out this way: specialty hospital, LGU hospital, and then funding also for DOH to use. But definitely there's the demand for more is there, Mr. President.
Thank you.
Mr. President, I was joking with my staff that there's also a hospital in Bukawi. I just wanted to put that on record, Mr. President, because our family donated the entire property, Mr. President. But kidding
The
aside, Mr. President,
Secretary knows about the Johnny Villanueva Hospital,
I think the
Mr.
Secretary had
President.
been there, if I'm not mistaken. Mr. President, having said that, Mr. President, there are a lot of hospitals complaining about unpaid hospital claims, Mr. President. In fact, as early as 2021, nakakatanggap na po kami. And may mga serious concerns being raised over the PhilHealth's delayed payments to both public and private hospitals, which at the time amounted to 26 billion pesos in 2021. Now, despite this long-standing issue and the DOH mandate to ensure policy alignment and effective coordination with PhilHealth, ang DOH has failed to intervene effectively in the payment systems used by the state's primary health insurer. And this resulted in the continued accumulation of unpaid claims, which as of January 2025, correct me if I'm wrong, Your Honor, distinguished colleague, had ballooned to 59.6 billion pesos. So my question, Mr. President, is what specific measures has the Department of Health implemented to address the delayed payments of hospital claims by PhilHealth? And why is it, Mr. President, why have these measures failed to prevent the accumulation of unpaid claims na ngayon ho lumobo na to 59.6 billion pesos, Mr. President?
So, Mr. President, as we're waiting for the comparative numbers coming from PhilHealth, His Honor is correct, no, that right now, as of October 2025, so a month ago, 162 billion
Wow.
claims have been paid,
Okay.
as His Honor mentioned, 162 billion. But that doesn't really mean anything if you cannot compare that with the previous number, right? So I'm asking for that. And then the, what's RTH again? Return to hospital. Yeah. Return to hospital is 2.6 billion. That means may kulang na information for them to be able to process it. But what they've done to expedite payments is that yung mga, nasagot ko to last week, so ano ba yung sinabi ko? Yung mga na-deny because of clerical error, and what else was it? Deadline. Marami kasing nadi-deny dahil na-miss lang yung deadline. So, yung ganon, binabayaran na. Yun. So, but yeah, I think it would be good to see what are those numbers, to see what changes have been made. Kasi we have been a recipient of the news coming, well, the public news, but coming from the hospital owners na, yun nga, over the years, lumala yung time that they get paid. But I also recall that I announced in the last, when one of our colleagues asked a similar question, that now they are able to pay even earlier than the 90 days ba? Is it 22 days, which is way below the 60 days. So 22 days na yung average nila under the new management, Mr. President.
22
So do
days.
you have anything to add?
May we know, Mr. President, yung current po ngayon, how much are we looking at? As I mentioned a while ago, January pa ho kasi yung data na natanggap natin, 59.6 billion.
So actually, Mr. President, under the new management, within the 90-day period, 25 billion has been paid. So I don't have the exact computation here, but meaning if there was 59 billion unpaid, then we know that within the 90-day period, 25 billion has been
25.
paid. Yeah, and then the others, Mr. President, already was during a period that already existed before the new management came in. Kasi after 90 days, it's 91 to 365 days. Eh, wala pa namang 1 year yung bagong management, Mr. President.
Yes, and we thank God for that na may bagong management, Mr. President. But can the department also confirm how many hospitals were affected because of this? Kasi may mga news din po na nabalitaan tayo that some hospitals have downsized, suspended operations, may mga sabi na temporarily were closed or tinuturo nilang dahilan is because of unpaid PhilHealth claims, etc. Can we hear from our friends from PhilHealth and DOH how true itong mga nababalita na ito,
Yes.
Mr. President?
Mr. President, they don't have data and they're not aware or they don't think that there are any hospitals that have closed because of this. But what happens is they refuse to accept patients that will be using PhilHealth. So technically, nade-deny nila yung mga mahihirap na umaasa sana sa PhilHealth. Yun ang nangyayari, Mr. President.
That's unfortunate. And may we know, because it's also close to our hearts, Mr. President, yung, for example, job termination, displacement, because of this, wala naman po tayong nabalitaan ganun, Mr. President. Days na lang yung hospital claim, sinabi na,
Mr. President, with regards to downsizing or the problem that they are aware of is because of the supply. So, pag nauubusan ng supply ng nurses, dahil nga umaalis yung mga nurse, doon nahihirapan yung mga ospital. Their downsizing would not be because of these PhilHealth payments, but because of the supply of nurses, according to them, Mr. President.
Thank you, Mr. President, for that. Last two topics na lang, Mr. President. Tungkol po dun sa immunization, National Immunization Program, I'm aware that Sen. Alan touched on this kanina sa kanyang intervention, and nag-set po yung Department of Health ng target of 95% full immunization for children under 5 years old starting 2024. And alam po natin na hindi ito na-achieve. Hanggang saan po yung ating na-achieve? And perhaps my question would be which regions consistently fall below the national target, Mr. President? Because what I have here, Mr. President, as of January 2025, only 61% of eligible children were fully immunized. And that's the reason why we're asking this question, if this is accurate, and how does the department justify a 34% 34 percentage point shortfall from its very own target, Mr. President?
Yeah, so Mr. President, the vaccination rate now is at 67%, so a little bit more than the 61%, but as His Honor said, it is very far from the target of, is it 95%?
95.
The target is 95% to be able to have herd immunity. So,
Problem is usually the mothers bring their first.
okay, so it seems now that the problem is with the vaccinations that require a second and third dose, because many mothers are bringing their children for the first dose, but it's the second and third, the follow-up doses that are not complete, Mr. President. So what they're doing now is intensifying their periodic routine immunization through regular monitoring at the regional level, conducting supportive supervision for priority areas with low coverage, conducting high-level weekly meetings to monitor status of inventory also, Mr. President, and procurement, as was earlier discussed, to be a problem, and capacity building for health workers on basic immunization courses. That's what they're doing.
Yeah, binanggit niyo, Mr. President, distinguished colleague, na sa first pupunta, sa second and third, parang hindi na sila bumabalik, Mr. President. Don't you think na may problema din sa information
Yes,
dissemination?
clearly.
You cannot,
Yes.
it's useless if you're only getting the first...
Ang sabi nila nakakalimutan. But maybe, nagka-house to house ba kayo? Kasi
Ngayon ang gagawin natin,
Oy.
puro kalusugan.
yung puro kulusugan is meant to be, but